Imagine your immune system, a dedicated defense force, suddenly mistaking your own nervous system, the network that controls everything, for an enemy. That's multiple sclerosis, or MS, a dangerous case of mistaken identity. MS affects millions worldwide. It's friendly fire. The body turns against itself. This battle rages inside, unseen but deeply felt. MS attacks the myelin sheath, the protective layer around nerve fibers. It's like stripping insulation off wires, disrupting electrical signals. The result? A cascade of neurological issues, mixed-up signals, unpredictable symptoms, tingling, fatigue, vision problems, and cognitive fog. No two cases are the same. MS is a uniquely personal, challenging, and frustrating journey. Its unpredictability makes better treatments essential. Not just to manage symptoms, but to slow the disease and give people back their futures. The ultimate goal: stop MS, repair damage, and restore lives. Scientists are racing to solve the puzzle, teaching the immune system to tell friend from foe. It's a fight for independence, dreams, and the neural pathways that let us experience life. The landscape of MS treatments has undergone a dramatic transformation over the years. We've moved from a place of limited understanding and even more limited options to an era of targeted therapies and genuine hope for those living with this condition. It's a far cry from the days of enforced bed rest, often the only recommendation, and a reliance on bizarre and unproven remedies peddled by traveling salesmen and desperate individuals. Back in the 1800s, when medical science was still in its infancy, doctors, often working with limited knowledge and even more limited tools, tried everything imaginable, from the seemingly unrelated act of removing teeth, based on theories of systemic balance, to the dangerous and ultimately ineffective practice of injecting snake venom, hoping to stimulate the immune system, desperately hoping to stumble upon a cure for a disease they simply didn't understand at a fundamental level. Then there was fever therapy, the incredibly risky practice of inducing malaria to burn out the disease, a treatment with potentially fatal consequences. It was another desperate measure born out of a lack of effective options. Real tangible progress finally began with the introduction of corticosteroids, which proved effective in helping to shorten the duration and severity of relapses, offering some much-needed relief. However, while corticosteroids addressed the acute symptoms, they didn't prevent the underlying long-term damage caused by MS. The real breakthrough, the turning point, came in 1993 with the development and approval of the first disease-modifying therapy, a monumental achievement. This new class of drugs offered the potential of not only reducing the frequency and intensity of relapses, but also crucially, slowing the progression of disability over time. This marked a fundamental shift in our approach to MS, moving away from simply managing symptoms to actively intervening in the underlying disease process itself. Gone are the days of snake venom injections and medical guesswork. Now, rigorous science and evidence-based medicine lead the way forward. The story of MS treatment, while still being written, is ultimately one of hope, remarkable progress, and relentless innovation in the face of a complex and challenging disease. Hey there! If you're enjoying this journey through the fascinating world of MS, don't forget to give us a thumbs up, hit that subscribe button, and drop your thoughts in the comments below. We love hearing from you. Your stories and questions make this community thrive. So go ahead, join the conversation and let's keep exploring together. Today, MS treatment is not just about managing symptoms. It's about fundamentally changing the course of the disease. It's a high-tech battle, a sophisticated and targeted approach. We're precisely targeting the immune system's troublemakers, those specific cells that are causing the damage, specifically B cells, which produce antibodies that can mistakenly attack the nervous system, and T cells, which can also contribute to inflammation and damage in the brain and spinal cord. B-cell depletion therapies using targeted medications are stopping relapses and slowing disease progression more effectively than ever, offering a significant improvement in quality of life for many patients. Immune reconstitution therapy, a more intensive approach, offers a dramatic reset, essentially rebuilding the immune system from the ground up. This involves wiping out rogue cells, the ones that are misbehaving and attacking the body, and then letting the body rebuild, generating a new, healthier immune cell population. The goal is a calmer immune system, one that no longer attacks the body's own tissues. Stem cell transplants, a powerful but complex procedure, though risky and not suitable for everyone, can reboot the immune system, offering the potential for long-term remission. This can halt MS progression for some, providing a chance at a more stable and predictable future. The Holy Grail, the ultimate goal in MS research? Remyelination, the process of repairing the damaged myelin sheath, the protective covering around nerve fibers that is damaged in MS. Scientists are testing drugs, exploring various compounds and therapies, to spark the brain's own repair mechanisms, stimulating the body's natural ability to heal itself. The aim is to restore lost function, to help people regain abilities that have been affected by MS. Imagine not just stopping MS, preventing further damage and disability, but reversing it, actually improving function and quality of life. This is no longer science fiction. It's not just a dream. It's the focus of cutting-edge research, the driving force behind many of the most promising studies. The future of MS care, the next generation of treatments, is being shaped by bold ideas, innovative approaches, and relentless optimism, a belief that we can and will find better ways to treat and ultimately cure MS. Despite progress, big challenges remain. The cost of new treatments is sky high, and access often depends on where you live or what you can afford. Side effects and infection risks mean every treatment is a careful balancing act. Progressive MS, where disability steadily worsens, is still tough to treat. Its underlying mechanisms are different and harder to target. Proving that a drug repairs nerves is complex, requiring sensitive tests and long studies. These hurdles slow down breakthroughs, making the wait for new treatments feel endless for patients. But each challenge is a call to action for researchers and advocates alike. Behind every advance are scientists, doctors, and clinical trial coordinators driven by curiosity and compassion, but the real heroes are the patients who join clinical trials taking risks to help everyone with MS. Their courage fuels discovery and progress. Patient advocacy groups and support networks turn individual struggles into collective strength, pushing for better care and more research. This spirit of collaboration is changing research, moving toward personalized medicine tailored to each person's biology. Scientists are searching for biomarkers to match patients with the best treatments, making care safer and more effective. The MS community is united, resilient, and determined to change the future. Together, they're transforming hope into real progress. The future of MS treatment is brighter than ever. The goal is shifting from managing MS to stopping and even reversing it. New therapies may soon reboot the immune system and repair nerve damage, making a cure a real possibility. Genetic tests and preventative treatments could one day stop MS before it starts. Technology, AI, and wearable sensors are sharpening our understanding and personalizing care. The story of MS is being rewritten by science, resilience, and hope. The journey isn't over, but the destination is in sight. Join the conversation, support research, and be part of this remarkable story of progress.